Hello, my name is Lisa. I'll be your nurse today.
Good to meet
Can you
you.
tell me your name?
Enid Ramos.
And Enid, where are you?
I'm in Southern.
What time is it?
It's 8 o'clock p.m.
And what is the date?
Today is April 23rd, Tuesday.
Right. And can you tell me why you're here?
For an assessment for work.
Okay, can you go ahead and sit on the table?
Okay, thank you.
And I can see that you walked in without any difficulty, so you don't use any aids. Correct? And you're dressed appropriately for the weather, and your mood is fine. Do you have any problems with depression?
Mm-hmm.
Okay. And I'm going to be palpating, inspecting, and touching you, so that's going to be okay with you.
Mm-hmm.
Nutrition-wise, do you have any difficulty with that? Can you tell me what you ate yesterday?
I ate pizza for in the afternoon, and then for lunch I had chicken with salad and a peanut butter and jelly sandwich in the morning for breakfast.
Do you have any difficulty hearing?
No.
Any speech problems?
Mm-hmm.
Okay. I'm going to get started doing an inspection on you. I'm going to start with your hands. First off, I'm going to wash my hands.
Okay.
Okay. Okay. I'm going to look at your hands, but first I'm going to start with your radial pulses. I'm going to be checking those. They are equal bilaterally. They're +2. Starting with your skin on your hands, you don't appear to have any lesions. Your capillary refill is +2, is less than 3 seconds, and your skin is actually you don't have any lesions. Your nail bed is pink. Your scalp is actually looks very good. You have no dandruff, which you were worried about.
Yeah. I wash my head often.
It's normal. Well, good. It's normal valley. Your eyes look normal. They are even. Your eyebrows are even. Your nasolabial folds are even. Your pupil fissures are even. Let's see. Your mouth is even in the lines. Can you open and close your mouth? I'm going to check your sinuses, and you can tell me if you have any pain like pushing on them. Here.
No pain.
I had asked you earlier if you needed to go to the restroom, and I did not ask you if you had emptied your bladder.
Well, since you advised me that I needed to do so before the assessment, previously I did.
Okay. All right. I'm going to start by assessing your eyes, and I'm going to get you to take this card and cover one of your eyes. So whichever one you want to cover, I'm going to cover my same eye, and I'm going to use my fingers, and I want you to tell me when you can see it in your field, your visual field. Okay?
No. No. No.
Okay. Cover the other eye.
No. No. No.
Okay. And I'm going to take this pencil, and I want to get you to follow this pencil. Don't move your head, just your eyes, okay? All right. Now, I'm going to go ahead and dim the lights in the room, and what I'm going to be checking is to make sure that your eyes are accommodating and that your pupils are equal and they react to light. They react to light. Is that okay? Okay. I'm going to get you to look straight here at me. And they do. And I want you to look at the wall. Just with your eyes.
Okay.
Okay, now look back. Look right here. And I'm going to do this twice. And they do it equally. Okay. Now I'm going to be looking in your eyes. And I'm going to be looking for the red reflex with this nice little machine here, twisting. And I'm going to be looking at your optic disc to see if it's creamy orange, and the back part you're looking for the vessels in your eyes, and just to make sure that usually the arteries are darker than the veins, and then we're going to look for the back part of your eye. And I'm going to be looking with this part of my eye so that I won't, And I do see the red reflex. And sometimes it's hard to see the disc, and I do see your disc. You blind?
Okay. My eyes okay?
Your eyes are normal. I'm going to turn this back on, and then I'm going to look at the structures of your eye.
Okay.
Okay. And your conjunctiva is clear. Your sclera is white, which is normal. I don't see any yellow spots or anything that would indicate that anything was abnormal. Okay. Okay, and then now I'm going to check your ears. I'm going to make sure that they're symmetrical. Can you tell me if that hurts when I pull them?
Doesn't hurt.
Okay. How about now?
Mm-hmm.
Okay, what I'm going to do is go ahead and take a look inside your ear. I'm going to check your tympanic membrane. I'm going to be pulling up and back. And it's pearly gray. You've got just a little bit of wax in there, but that's normal. And I'm going to do a hearing test on you. And what I need you to do is to take your finger and push it on your auricle. And I'm going to whisper a word, and I want you to tell me if you hear it.
Monday. Airplane.
And I'm going to come on this side.
Monday. Airplane.
Okay. Okay, I'm going to check your nose. Your skin looks good. Do you have any pain in your nose?
Mm-hmm.
Your nose is symmetrical, it's even, and it is the color of your face, so that looks good. I'm going to check the patency of your nose.
Okay.
Can you sniff for me? Hold one side and then the other. Okay, I'm going to go ahead and get the light. I'm going to shine it up your nose and look in there. If it's uncomfortable, I'm sorry. It looks pink and moist, and I don't see any polyps. Perfect. Okay. Now, I noticed that you deviated a little bit. Can you tell me about that?
Just acne in the nose many years ago.
You don't have any trouble breathing?
No problem.
Do you have any problems with sinuses?
A little bit, but not too much.
Okay. Okay, and now we're going to go ahead and assess your mouth. Your lips look good and pink. They look moist. So I'm going to go ahead and get you to open up your mouth. I'm looking at the internal structures of your mouth. Go ahead and say, ah.
Ah.
Stick your tongue out for me. I'm going to do a gag reflex on you. Well, that is good. Okay, lift your tongue up for me. Okay, from your mouth. Do you have any open sores or anything in your mouth? Okay. Okay, now I'm going to be checking your neck. There are 10 sets of cervical nodes that I'm going to be checking on you. And I can see that your trachea is midline. I'm going to go ahead and just check it. Are you in any pain? Your skin is good and tan. I don't see anything. Thank you for changing shirts for me. Okay. I'm going to check. Your preauricular. I won't name them all. Your postauricular. Your occiput. Are you having any pain? Okay. So mental. That doesn't hurt. Get you to shrug your shoulders. I'm going to check your carotid. Okay, I'm going to check range of motion in your head. Can you, in your neck, in the back, to the side, to the other side. Now I'm going to check you with resistance. Okay, the other side. Shoulders. Okay, now I'm going to assess your thyroid. What I'm going to do is walk behind you. I'm going to give you a glass of water. I'm going to get you to swallow. I'm just going to palpate to see if you have any deviations or any kind of water.
Thank you.
Okay. Okay. Go ahead and
Should I
swallow.
swallow?
Yeah, go ahead and swallow. Okay, one more time. Okay. Okay, Okay, and since I'm already back here and I've just assessed your thyroid, I'm going to be doing your chest and lungs, and I'm going to be assessing your posterior thorax first. Okay?
Okay.
So the first thing I'm looking at is I'm looking at symmetry in your back, and I'll be raising your shirt up here in just a few minutes to look at your skin.
Okay.
And it looks symmetrical from back here. I'm going to be doing a few tests on you and asking you to do some just repeating of some words and some numbers for me.
Okay.
So the first thing I'm going to do is get you to say 99.
99.
Again.
99.
Again.
99.
Amen.
99.
Okay. Can you take a deep breath in for me? Blow it out. Okay, I'm going to raise your shirt up and just look at the symmetry on your
Okay.
back and your muscles and your skin. And you don't have any skin lesions, no to touch. Okay. I'm just going to be palpating you. Does that hurt? Okay. I'm going to touch your sinus process. I know that feels good.
Feels like a good massage.
Okay, I'm just going to listen to you. I'm going to listen through your shirt. I know you, unless, do you mind if I raise it up? Okay. Deep breath in. Blow it out. Okay, now I'm going to check your diaphragmatic excursion. And what I'm going to ask you to do is to take a deep breath in and hold it.
Okay.
And then I'm going to ask you to let it all out.
Okay.
And then we'll go from there.
Okay. Just let me know.
Okay. So what I need you to do is to take a deep breath in and hold it. Okay, let it all out. Okay, take another deep breath in and hold it and let it all out. Okay, you can breathe. We're going to try to get on this side, okay?
Okay.
Take a deep breath in and hold it. Okay, take a deep breath. Okay. Take another deep breath in and let it all out. Okay. Okay, it's 2 on this side. And 2.5 on this side.
Okay, good.
Come around the front. We're going to do something similar on the front.
Is that normal?
That is normal.
Okay.
Okay. I'm going to come around front here. I want you to do, remember we did 99 on the back side, we're going to do that on the front side.
99. 99. 99.
Okay, take a deep breath in. Blow it out. Didn't have it. get you to lean forward slightly. Just lean forward for me. I'm just listening for any murmurs. Okay. I'm just going to look at the symmetry in your chest. And your skin looks good. You don't have any pain. Okay. I'm going to check the range of motion while you're sitting here. And your hands, can you put your hands up like this? Raise them up. About your elbows. Here, and above your head, and down. Okay. Okay. I'm going to be listening to your heart sounds and checking for your apical impulse. So I'm going to be palpating and listening through my stethoscope. If I heard you, let me know. I'm going to get you to turn over to your right. Now I'm just going to be listening at the apex of your heart for your, and I don't hear any murmurs or any ambulatory sounds. I hear aspirations too. Okay, you can go back on your back. I'm going to be assessing your abdomen, your skin. Do you have any pain in your stomach? And I can see that you don't have any lumps or bumps, or your skin is smooth, and it's even. I'm going to be listening for your vascular sounds. And your bowel sounds. And they're hypoactive. And I'm just going to lightly palpate your stomach. You can relax your legs. A little bit deeper. All right. Okay, so understand. I'm gonna measure where your spleen is at, and also look where your liver's at.
How much is it measured?
I'm gonna measure both sides of it. Okay, your spleen measures in centimeters 4.5 at your femoral and your inguinal areas. Look at the skin, and I'm going to check your pulses. Your skin looks good. There's no tears or no lesions. Is that ticklish? Sorry. And your pulses are good. So +2. Okay. I'm going to look at your lower extremities. And you got on stretchy pants for me, thank you. And I see you shaved your legs, but you do have hair distribution. And your skin is good and clean, and there are no lesions. And it is cool to touch, but it's warm. And your toes look good. And there's no lesions there. I'm going to check your pulses. Get you to bend your neck. Those are all +2. Okay, those are 2. Okay, I'm going to get you to do some range of motion for me. Can you lift this leg up for me? Okay, I'm going to help you, okay? I know your back's hurting you. Okay, just lay it down. And can you bend, like, do a leg squat? Yeah. I'm going to help you on this side, too. Okay, lift this one up and lay it down. And do the same thing with bend your knee. Okay, all right. Okay, I'm going to test one more thing on you. And what I need you to do is to take your heel and slide it down your shin. Okay, the other one. Okay, I'm going to get you to rotate your ankles for me, too. Okay, all right. Okay, and I'm going to go ahead and take your shoes off. Okay, I'm going to go ahead and assess your neuro. And what I want to do is I'm going to be touching you with a few things. They're going to be dull and sharp. Go ahead and uncross your arms. This is going to be sharp, and this is going to be dull. I'm going to get you to close your eyes, and you tell me what you feel, okay?
Dull, sharp, sharp, dull, dull, sharp, 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 dull, sharp.
Okay, you can go ahead and open your eyes. Just tell me if you feel this.
Barely.
Okay, next I'm going to go ahead and check your reflexes. But first off, I'm going to check your process and your elbow. Okay, I'm going to go ahead and get you to stand up because I'm going to check some range of motion and get you to walk across the room. If you'll walk this way for me. Okay, I'm going to get you to walk back, but what I want you to do is do toes to your heels. Now, can you walk on your toes that way? And when you come back this way, go ahead and walk on like heel to toe. Okay. Now what I want you to do now, I'm going to go ahead and check your mobility in your back, and I know it hurts, so I want to hold you and kind of stabilize you. Can you touch your toes for me? Okay, come back up, and can you bend back as far as you can? Okay. And what I want you to do is turn side to side. Okay, go ahead and sit back down. Oh, there's one more test I do forget to teach you to do. I need you to go ahead and stand back up. And it's the lumbar test. I need you to close your eyes because I'm going to check for swelling. Okay, you can sit back down. Okay, Enid, we're going to go over your results, and it appears that everything is normal. We talked about your deviated septum, and you don't have any trouble breathing with that. Your skin is great. I didn't see any lesions at all. You're not having any pain. You did have some seasonal allergies, but as far as that goes, it was okay. You didn't have any trouble with your eyes. Everything was normal on your eyes. Ears, you had no trouble at all hearing. Chest and lungs, everything looked good. As far as your abdomen, I did not do deep palpation on your organs because you told me your back was hurting you. You heard it at work. So I didn't do any of that, and I appreciate you helping me sit up and doing all that. I know that you had a problem with your back and you had limited range of motion, and you're having all that checked out. Your breast exam, we did not do a breast exam because that's not part of what we're doing. But do you do self-breast checks? So you understand, like getting in the shower, soaping up, you do it regularly once a month, same time every month? Okay.
How about calendar in my shower?
You have a calendar in your shower. Do you have any problems? I know you have high blood pressure. You take regular medication for that, so no trouble with anything. You see a regular doctor?
No, it's stable.
Stable. Do you have any other problems? So everything was normal. Do you have any questions?
No.
Okay.
Thank you.
Thank you very much for
All
helping
right,
me.
thank you.